This episode is brought to you by Experis. Health IT is complicated. Finding the right partner doesn't have to be. At Experis Health Solutions, we deliver the expertise you need to modernize, optimize, and innovate faster, helping you improve patient care while maintaining a healthy bottom line. From advisory and implementation to optimization and managed services, we've spent nearly 30 years partnering with over half of U.S. health systems to drive meaningful transformation. Need a single expert, a full team, a tailored solution? We've got you covered. Flexible, scalable, and designed for your success. Experis Health Solutions, fueled by passion, measured by impact. Learn more at thisweekhealth.com/Experis. Welcome to This Week Health. I'm Sarah Richardson, a former CIO and president of This Week Health's 229 Community Development, where we are dedicated to transforming healthcare one connection at a time. Our interviews in action are a series of interviews catching up with healthcare leaders throughout the industry. Now, on to our interview. Welcome to This Week Health and our executive interview series. I am Sarah Richardson. Today, I'm joined by Davin Juckett, head of Experis Health Solutions. Davin brings extensive leadership experience to healthcare IT with a strong background in finance, entrepreneurship, and strategic planning. Welcome to the show, Davin.
Thank you, Sarah. It's certainly an honor to be here, and I appreciate your time.
You've been in the healthcare IT space for quite a while. I'd love for you to give us a bit of the history behind Experis Health Solutions.
Sure. Well, first of all, I would say we focus exclusively on hospitals and health systems, and we have provided a broad range of managed services and talent solutions to health systems now for nearly 30 years. But we've done so under a few different company names. We started in 1996 as Etain Health, which was a division of Etain Group. Around that same time, there were other strong players like Max IT and Vitalize Consulting who were growing in the healthcare IT space. In 2013, Max IT and Vitalize were acquired and brought together under Leidos Health. And then in 2019, Etain Health acquired Leidos Health, and that brought together decades of experience under one roof. And then most recently and finally, in October of 2021, Etain Group was acquired by Experis, which is when we officially rebranded as Experis Health Solutions. So, even though we've had a number of name changes, and I would say it's likely had a bit of an impact on our brand recognition, our key team members and our focus on serving health systems have remained constant throughout.
And with such a long history, how would you say the business has evolved and how that integration has shaped your current service offerings?
Great question. In our early years, I would describe us primarily as EHR implementation experts. That's where we originally built our reputation, by sort of delivering on those complex implementation projects. But over time, clients were asking us for more types of assistance. They didn't just want help with implementations. They needed experienced healthcare IT consultants. They needed EHR optimization, and then ongoing management support. So basically, we grew with our clients, and whether it meant delivering one consultant with a specific skill set or really scaling up to provide dozens of resources at a time, we've always shaped our services around what our clients actually need. Sometimes that means that work happens under our own direction, and then other times it's basically fully embedded within the client's team. But ultimately, for us, it's about delivering the right solution, the right way, and at the right time. And so that mindset really helped our organization to grow to now more than 750 consultants. We're proud to be one of the largest staffing and managed solution partners for healthcare systems in the U.S., and proud that we have clients in every state in the country. I'd say we've evolved by staying close to what our clients need. We're always listening, we're always adapting, we're always focused on delivering value that lasts. And we believe we're more than just an IT vendor, and we hope that our clients view us as really a long-term partner that helps their organizations expand services, improve care, and protect their bottom line.
Which is such an incredible journey, and one that's so important right now, especially with all the budget pressures that are coming across and margin compression for all of these healthcare systems. What would you say sets Experis Health Solutions apart today when you're working with your existing clients, but also meeting new clients?
Yeah, great question. I'm someone that likes to think in threes. And so I would say three things. I would say it's our experience, it's our people, and it's our approach. As we've previously discussed, we've been at this for almost 3 decades now. We're proud to have now partnered with more than half of all the health systems in the United States. We've completed almost 5,000 projects over our 3 decades of experience. But to me, it's our people, it's our teammates that make the real difference. Our team brings deep healthcare expertise, very long-standing client relationships, a real passion for doing the right thing. I also think that team continuity matters a lot, and I'm really proud of our retention record. In the last 5 years, we've had fewer than 5 people on our team, which now numbers in the several hundreds that have voluntarily left our organization. So for our clients, that means, they get consistency, they have strong relationships, and teams who truly understand their environment over the long term. And then lastly, our approach. I think we bring a startup mindset to everything we do. We've built and we've scaled new solutions time and again, always listening to our clients and just basically trying to meet them where they are and satisfy their needs.
And I understand that Experis has significant experience with major EHR systems, including Epic, Cerner, and Meditech. What unique challenges are healthcare organizations facing with their EHR systems today? And how is your team helping them overcome these obstacles?
Yeah, well, obviously, there's a lot happening within healthcare today. There's a lot of financial pressure on health systems. AI is becoming a bigger impact, like it is across many industries. And there are growing security threats, and that's just to name a few. To me, I think our overarching challenge really is to help health systems improve the return on investment that they've made over the years in modernizing their EHR systems. And I think there's a number of ways we are working to help our clients to do so. And I'll tick off several. One, we're investing in AI-driven automation, primarily with our AI-powered clinical service desk. We provide outsourced clinical service desk services to now over 200 hospitals throughout the US. And our services help to improve response time and call resolution rates. And with the national scale that we have in the operation, by outsourcing service desk needs to Experis Health, we actually can help reduce our clients' operational cost. We can help improve their IT efficiency and even help them to generate incremental revenue. So we're proud of the work we're doing there. Two, as healthcare systems increasingly migrate applications to the public cloud, we are bringing now best-in-class cloud security and compliance to our clients. Three, we're starting to build what we call clinical concierge solutions. These are focused on solving several major problems that healthcare systems are facing. And these include helping to maximize reimbursement, reduce 30-day readmission rates, improve patient satisfaction scores, reduce the burden on their providers. And ultimately, we think we can help, at least to some extent, help solve the nursing shortage in the country. Four, many of our clients are some of the largest health systems in the country. They continue to be involved with a lot of M&A activity. And so we're helping those clients to integrate, modernize, and scale their IT infrastructure without disrupting care as they're bringing together acquired hospitals and facilities. Five, we have a supply chain optimization service that really helps maximize revenue for clients by improving their charge processes and helping identify essentially missed revenue opportunities within the health system. The last thing I would mention, but it's certainly not the least, and it's something we've been doing really since the beginning, but we're now one of only a handful of firms still providing EHR go-live services, sort of that final step in the implementation process. And really, just in Q1 of this year alone, we successfully staffed 5 different go-live projects that totaled over 2,000 at-the-elbow resources. So one of the biggest quarters we've had in our history, and proud that everything went well.
That's phenomenal, because consider what's happening with even the M&A aspect. The M&A aspect has to have that seamless integration, ideally sooner than later, with the things that you're talking about, whether it's what elements of AI and automation, what cloud strategy you employ, how you're maximizing supply chain, how you're addressing clinician shortages and burnout, the quality metrics and all the things that are being tracked. When you have a partner like Experis that can do that for you, soup to nuts, you want them at the table for multiple projects. So when you join as a partner with an organization, it's for more than just a one and done scenario. And you can see how that embedded value over time not only makes health systems better, but as we see what I almost call the great migration right now, people are switching jobs pretty routinely throughout our industry. They're taking you with them. And that's a huge moniker of success for what you all have delivered to our organizations and to our industry.
I really appreciate those comments, and you really hit at the heart of what we try to do. Again, we want to be sort of most trusted partners with our clients. And again, I think we've done a great job of listening and asking what other ways might we help. And so, yeah, I think that's been a big part of our long-term success.
And before we wrap up, what are your final thoughts on where Experis Health Solutions is headed next?
Well, I mentioned that our long-term success. I certainly hope we can continue that track record. But as we've, just talked about a little bit, our clients, healthcare organizations, are under a lot of pressure right now. They're being asked to expand services, improve patient care, and still try to remain profitable. And so basically, we believe we can help. We have proven experience helping our clients in practical, meaningful ways, whether it's improving patient access, tightening up the supply chain performance, or just keeping IT operations running successfully. We've been able to bring solutions that not only reduce costs, but actually help generate revenue. And again, I'm proud we listen to our clients, and hopefully we can help them move forward with confidence and create truly long-term impact on our clients. So that's what we're focused on doing in the future.
Which is so important. One of the monikers we have at This Week Health is that leaders in isolation are sure to fail. And CIOs that are partnered with you are not in isolation, and therefore failure does not need to be part of their roadmap.
We certainly hope that is the case.
So now I get to ask you some of the fun speed round questions, which is always a great way to get to know people a little bit better. I can't wait to hear what you're going to say because you have so much experience and run such a successful organization. What is the one book that has influenced your leadership style?
It's a tough question, especially because I mostly read fiction books. But last year I read Outlive by Peter Attia, and thinking about that, I think Dr. Attia's approach of taking a very forward-thinking, long-term, very proactive approach in treating chronic diseases equally applies to the challenges we face in business management and as leaders. And so that's had an impact.
I have that book on my shelf, and I also loved his interview on the Huberman Lab. If you haven't heard it, it was really well done. And to your point, how you make some decisions in life a little bit differently after you read and listen to the things that he has to share.
Absolutely. It's definitely impacted my life, both personally and from a professional perspective.
So if you weren't in healthcare IT, what would you be doing?
Well, it would definitely be entrepreneurial in nature. Really, it took me a while to figure it out, but that's really what I'm best at, is operating in entrepreneurial environments. And so, it would be entrepreneurial, perhaps either starting another company, which I have past experience at, or at least advising, other aspiring entrepreneurs and trying to help them out.
Which is perfect for my last question for you. What is your go-to advice for healthcare CIOs navigating the challenges they're facing today?
Well, the short answer, of course, is always call Experis Health Solutions. No, that's number one. But I will take this opportunity to highlight something. It's a report that Experis just published. It's our 2025 CIO Insight Report. And it's based on interviews and responses from 1,400 technology leaders globally. And it was very interesting to see that 76% of these technology leaders say that finding the right talent is their biggest single challenge. And finding IT talent is really the core of what we do at Experis Health. We bring the people, the solutions, and the partnerships so our clients are not having to figure it all out on their own. So that's my answer there. And by the way, if you're interested, you can check out that full CIO insight report at experis.com.
Yes, we'll include it in our show notes as well. And what I love about what you just shared is that we routinely are hearing about the shortage issues, especially from an IT perspective. We know there's a clinician shortage coming, but again, that IT shortage is huge as well. And especially in the rural and harder to fill locations throughout the country, it's important to know that they can call you to figure out how to make sure that they don't have a deficiency in their ability to provide care, both technologically and clinically. So thank you for helping organizations not have to worry about that aspect of running their companies.
Absolutely. It's our
Isn't-
pleasure.
Davin, thank you so much for joining us today. For our listeners who want to learn more about Experis Health Solutions, where can they find you?
Sarah, thank you again. I really appreciate the time and I've enjoyed our discussion today. Anyone can feel free to reach out to me directly at davin.juckett@experis.com, but also visit our website. The website is experis.com. And once there, you can choose the industries dropdown and then choose healthcare.
Excellent. And also for our listeners that are part of our communities, anytime you're looking to connect with our partners, you can reach out to us and say, hey, what was that interview that I heard recently? Or who was the person from Experis? We can also make those connections for you if you are a practitioner and seeking the right solution. So thank you for being one of our partners as well.
Thank you, Sarah. Again, it's been a real privilege speaking with you. I appreciate the opportunity to share more about Experis Health. We are really excited to be partnering with This Week Health as well.
Thanks for listening to this interview in action episode. If you found value in this, please share it with a peer. It's a great chance to discuss and in some cases, start a mentoring relationship. One way you can support the show is to subscribe and leave us a rating. If you could do that, we would appreciate it. Thanks for listening. That's all for now.